Sex Talk with the Siegel Brothers is a weekly program designed to answer all your questions, including the ones you didn't even know you had, and to clarify the endless debates around the wonderful and fascinating world of sexuality. Join us for real talk about sex from two experts in the field. Richard and Larry Siegel have over 50 years of experience as sex therapists, educators, counselors, and researchers. The Siegel Brothers are recognized around the world as trainers of medical and mental health professionals.
Hello and welcome to Sex Talk with the Siegel Brothers. My name is Dr. Richard Siegel and I'm a certified sex therapist.
And I'm Larry Siegel, a clinical sexologist and certified sexuality educator.
And my awesome big brother.
My favorite role. To you, my brother.
To you indeed, our traditional sake toast.
Yes, indeed. Thank you. And
welcome.
Thank you all for joining us.
Welcome to you. Thanks for joining us. If you're joining us, if you've hopped over from Facebook, please do us a favor and hit the like and share buttons. And if you would be so kind as to subscribe to our YouTube channel,
yes,
we would be very grateful.
And hit those thumbs up buttons as well. And all the support is both helpful and appreciated.
Thank you to all our Facebook crowd who really pulled through for us. We are indebted to you.
Indeed.
So our topic this evening, we've been talking for the past couple of weeks about men maybe could do a better job of being better lovers, better other-centered lovers, and learn more about pleasure. Last week we had kind of an admittedly heterosexist but an important discussion about what men who are attracted to women can know more about them and how female sexuality works and the things that most men think make sex are usually not the things that most women find pleasurable. Right? But this week we wanted to take a look at maybe a little bit more medical angle and talk about how men's sexual health is not given the importance as female sexual health, it seems. Like women are on it. Most women are on top of things, whether their periods or birth control or annual exams and pap smears. Ask your average guy what the last thing he's done for his sexual health.
Well, ask the average guy what he knows about his body.
Right.
That's really the I think the crux of a lot of this.
Maybe
women have been
guys
almost forced into at least being a little bit more body conscious and aware of how all that stuff works because they really are confronted with, I would just say, more plumbing issues than a lot of men are.
Yeah.
Even when we talk about sexual health, that's still been a responsibility put on women for years. Sure. And men, whether we're talking about heterosexual men or gay men, and I really can't speak to trans men on this particular issue, but certainly heterosexual men and gay men, again, it's still, they don't necessarily know a whole lot about their bodies.
Guys don't know where their prostate is. They're not entirely sure what it does.
Yep.
They really don't know much. Maybe some college guys who had a sex ed class did the roly-poly testicular cancer self-exam once.
Maybe, but they don't know what's in it. They really don't know what's under that scrotum.
Hopefully someone explained to them what they should be looking for when they're doing that roly-poly thing.
Okay, so, all right.
A couple of guys who go, oh my God, there's two big hard things. Yeah, those are your epididymises.
Epididymi?
They're supposed to be there.
Right, exactly. Right. Now, even just as a name, as a word, how many guys really even know what that is?
What an epididymis is?
What the epididymis is. I once asked that question to a group of professional men, and I basically got a character from Greek mythology.
Probably named for one point or another. What's your favorite definition of epididymis?
My favorite definition of epididymis that I've heard or that's actually true?
Well, I'll tell you mine. You tell me yours.
Tell me yours. I'll tell you mine.
I like to call it sperm training camp.
Ah, very nice. Very nice.
That's what the epididymis is for.
Yes. I call it more, or refer to it more as a maturity zone.
Well,
right?
Same
camp,
difference. Maturity zone.
Same difference, right?
But guys think when they ejaculate, well, first of all, a lot of guys don't really understand that sperm and semen are not the same thing.
Not the same thing.
Right? Bill Clinton, there was a sperm stain on the dress. Not without a microscope.
No,
right?
unless those are some really big sperm.
Right. Semen is a fluid that sperm swim in.
Right.
And guys think that
along with many other things,
when they ejaculate, sperm come from their testes. They don't.
No, they don't.
Coming from that epididymis, from training camp where they've been for quite some time.
Actually, even beyond there, the holding area. Right?
Okay.
So really looking at that too. Now again, those three things, right? Ask most guys if they know what their testes actually are, and if you ask them how big are they and how much how much tubing you have in there, ask them what and where their epididymis is, and ask them what their vas deferens is. Right? And I would say the majority of males.
That last one, they'll have to look in the hall closet up on the top shelf where the stick things they don't know.
That's right. That's right.
It's
but
true.
So
because,
we are woefully ignorant.
As we've been discussing, sexual health is it's too quiet.
Yeah.
Right. How did we put it? You put it last week, right? Sex negativity cells. Making people feel badly about their sexuality cells.
That's right.
But sexual health, not such a sexy idea.
No, it really isn't.
Which is crazy, because who wants to be sexually unhealthy?
Right.
Who wants to pee fire?
And who wants shame?
Right.
Who really wants sexual shame?
So who do men talk to? Who do men go to? Since there's, sex therapists tend to be few and far between in this country, especially. And as we discussed a long time ago on one of the radio shows, the United States is not as hip as places like Cuba and Venezuela, where there are sexual health clinics all over the country. So who do guys ask? More often than not, by default, it ends up being the urologist.
Well, right? Let me take a step even backwards.
Right,
they don't even get to the urologist most of the time. Who do most guys ask? Other guys or porn.
Yeah, or Google,
right?
maybe.
Or maybe they'll go to, some kind of a subreddit, right? But the problem is most guys don't know a whole lot about sex and sexuality, including, if not especially, their bodies, and they don't really talk to anybody about it.
Right.
And that's really the biggest issue. I think we wouldn't have a lot of these issues if guys did speak to their doctors. So one of the things that we're going to focus on tonight is who can guys talk to about sexual health and healthy sexuality. And
that guys need to be a little discerning, because again, the go-to PP and vajayjay doctors, urologists for men, not like women don't have urological systems, but women, if they will ask, will likely ask their gynecologist.
Yep.
And men, if they will ask, will likely ask their urologist. And that assumes that gynecologists and urologists know anything about sexuality.
Right, exactly. It also assumes guys go to urologists, and realistically, most guys don't even think of a urologist until later in life.
Yeah, that's true. Right?
When it is too late.
That's when they discover what their prostate is, and when it
that's
starts
right. When
to
they're
grow,
introduced to the finger,
and when it starts to grow, and they have to get up 6 times a night to pee. So we're excited to we're anticipating a fun interview with an old friend, one of our first guests, in fact, on the old radio show, who is a bit of a unicorn. He's a psychiatrist. Well, actually, he was an environmental engineer for his first part of his career. Then he shifted to psychiatry, but he, counsels his patients. He's judicious with medication, and he's, best of all, trained as a sex therapist. Go figure.
Wow,
right?
A psychiatrist that counsels, that does not have a knee-jerk response to giving drugs, and knows about sex. That is a unicorn indeed.
Yeah, and we'll have to ask him. I don't remember the story of how he ended up in, of all places, Lawrence, Kansas. But we will be zooming to Lawrence, Kansas momentarily.
Yes, indeed.
So stay with us, and we'll be back after a quick break.
I'm Rachel Needle, co-director of Modern Sex Therapy Institutes. And Modern Sex Therapy Institutes is a continuing education provider. We provide continuing education for medical and mental health professionals around the world. And we have over 140 archived workshops on our website, so please check them out at www.modernsextherapyinstitutes.com. Also, we have a number of certification programs, including sex therapy, couples and sex therapy, LGBTQIA affirmative therapy, alternative relationships, transgender mental health care, medical sexology, sex education, and sex counselor certifications. In addition, we offer a PhD in clinical sexology. So please, again, go to our website, check out everything that we have to offer. A lot of our stuff is available solely online from the convenience of your own home or office. We do things live in 8 states and live via webinar as well.
Well, hello, we are back, and as I promised, we are very, very honored and looking forward to a chance to talk with a return guest, or a returning champion from Lawrence, Kansas, Dr. Hiten Soni. Welcome.
Well,
back.
thank you.
So good to see you.
Yeah, it's been
Well, good to be seen. Good to see you guys as well. It's been a while.
It has. It really has.
one of our first
So-
old radio show. Now we're going rogue on YouTube, which is nice. We don't have to worry about FCC censor in the other room hitting the button every time we say hard on or something like that.
Right.
Exactly.
Yeah.
Exactly.
Well, that's wonderful. So I know, like in one of the lecture I was giving to a third-year medical student, and I used the word erection, and they're like looking at it, like, can you say that? It's like, it is medical school, you know, and these are like young kids, you know, like kids, and it's like 25, 27. And it's like, yes, I want you to use these words, please.
Yeah.
You know, I want to start with that actually.
Go ahead.
You gave us a good starting point. As you know, as we've been talking about men and what men generally don't know about their bodies and sexuality, and again, we certainly want to talk to you about where guys can go and who they can talk to. But I think we have to address this, you know, not so big elephant in the room. That do doctors really know about sex and sexuality? Are they really taught any of this in medical school?
Oh, I was shocked when I went through the medical school. We had zero. Okay, besides from what you learned in anatomy and the physiology, it was zero. So it was quite shocking. So the first time when I wanted to seek out, and I took the class with Dr. Ranshaw and the sexual dysfunction clinic, and so even when we were learning history, taking and practicing, and we would just say, well, any trouble in a bedroom? It's like, yeah, like
The laundry's piling
the
up.
drapes don't match the bedspread, or
right, or is the ceiling leak in the bedroom?
Right.
Like, what do you mean, like trouble in the bedroom? Like you need a new carpet, or yeah.
So thing to ask.
Yeah, so the history taking part was very poor. We are doing the training, and so this gentleman, he's from Saudi Arabia, and part of the training is to take it's a mock patient, they call the standard patient. This is an actor, and so he has to take the history, and in the history he goes, you know, you and the missus, you know. and that's the gesture he uses, and we have to stop him, and it's like, so what are you actually asking? He goes, you know, it's like, no, you have to use the word that how often do you have sex? Can you say that?
Right.
Okay. Is it this experience?
Concerns. How hard
Yeah.
is it to say?
Yeah. Are there any difficulties? Anything you want to talk about? And it's like, yeah. So taking history was teaching students then to taking medical history, and then making sexual history is a part of it. And it's like, well, the quality of life,
Right.
it's so dependent on it. And then if somebody comes to you and you completely miss it, then you haven't done that patient service. And so first we need to really make sure that the doctors, we need to go out there and get to the medical schools right there in the third year, fourth year medical students, and start teaching them that yes, cardiology is wonderful, nephrology is good, there's no doubt about it. But for some reason then you can't relegate these things out of the primary care realm.
I'm glad you said that. Yeah, because we were talking earlier. I think there's this knee-jerk reaction that women automatically think their gynecologist has the answers, and guys think the urologist has the answer. And as Larry said, guys don't go to the urologist until their prostate starts growing, right?
Mm-hmm.
So if gynecologist, Larry used to say this years ago when Dr. Soni and I were both trained by the late great, and as Larry was as well, by the late Susan Lee.
Yeah.
And she was one of the first to start attracting, such as you, medical clinicians to get this kind of training in sexuality counseling. And Larry's favorite joke was, hey, those genitals you're working on all day? Just remember, they're attached to people, and people use them in ways that affect their lives and their relationships.
Yeah, that's hilarious.
That's technicians, right?
Yeah, exactly. Then you just pretend that it doesn't happen, and then you start teaching the history taking, and start getting them to use the words, the vocabulary, getting them to say penis and vagina and fluids and things like that. These are not bad words. We need to get them to use them in a discussion and say, well, let's see. So one of the questions that you would ask is, so how old were you when you had your first sexual experience? And then you would come and ask the second question. So how old were you when you had your first sexual intercourse? And they go, oh, well, let me go back and answer the first question then, because it's like they think that it's the same thing.
That's exactly
and
right.
it's like it's not. And one of the other things that I learned from my medical training, as inadequate as it was, Dr. Kumar would tell us, he goes, do not ever ask to like a 14, 16-year-old if they are sexually active, because you just assume that they are.
You're right. Right.
And just say, when was the last time you had sex?
Mm-hmm.
And you're asking a 14-year-old, how did you know? It's like, yeah, just ask it. Yeah. And
better to assume, let them tell you, no, I haven't yet, instead of those back tightening questions like, do you masturbate? No, of course not. I'm not supposed to. I just said, how often, or when was the last time?
There you go. How often
that everyone does.
Yeah.
And then let them tell me, no, I don't masturbate.
Mm-hmm.
Then I want to know why.
Yeah.
Right. So the primary care ought to be the place, I think, that we would go.
Medicine, right? What's the distinction? Would you say family medicine or?
It's the same thing. The primary care, family medicine, yeah, and that's where it ought to be, because then we say that we take all the other histories, like any frequent headaches, any difficulty breathing, chest pain, stomach ache, any problem with erections. Yeah. And then you just make it very normal as a part of that, and then get it. But you're so right about the education. You think that in 2020, then we would have come far ahead in terms of educating medical students. Well, what are you guys seeing?
Well, kind of the same. I mean, there's the circles, the folks that we know, the folks who do recognize that it's an important quality of life issue. And again, not just urologists and gynecologists, some cardiologists and gastroenterologists, neurologists, right? It's starting to spread, but it's just still very, very small. And even, sexual medicine, we like to kid around and say it was born when the FDA approved Viagra in '98, but it's been around, at least a century.
Right.
But it's just never
really made it to the surface.
Yeah. So just encouraging people and doing podcasts like this and making it part of a normal everyday conversation, taking the stigma out. And in my psych practice, it's part of the bread and butter. That's what. So every psych eval we start with the orientation, and we go and we ask about the functioning, and then it's like, wait, it's our first meeting. It's like, yes,
right.
Well,
I love that. family
Yeah,
therapy.
and it's like, well, I came for depression, and it's like, well, yeah, we will help you with the depression, but we want to know, and we asked about the orientation, and with the younger people, it's a lot easier now
Sure.
to do that. But somebody in 50s and in the 60s even, like our age, and then it's still hard to, well, not you, our age. You're younger.
Thank you. You've now just become my favorite person.
Yeah. But so our age, so I asked people, so how do you identify yourself? And he goes, Larry? I identify as a Larry? And it's like, no, like, can you tell me, like, how do you say, how do you identify, like, orientation wise? And it's like, well, you mean like north? So like what? Like which way is north? It's like no. Then you have to come out and say, well, do you think you're straight, bi, gay? Oh yeah, no, I'm normal. Yeah. So it's like, okay, normal. Okay,
Yeah.
well, like,
Yeah.
so what I'm hearing that you're heterosexual is what you're saying. Yes. Yeah. What else? Like, yeah, but just need to know. I'm just asking, and then. It takes a long time sometimes for them to like just come out and ask.
Right.
Yeah.
And, it's funny when you talk about assumptions that many physicians make, because I do a lot of work with seniors and I've been for the last couple of years as well, as you know.
Yeah.
But I find it very interesting that many physicians will work under the assumption that adolescents are sexually active, and they will work under the assumption that anybody over 70 is not.
Yeah. That is
Of course, we know what a huge mistake that is in South Florida, when the dating criteria goes from looks to money to conversational skills to, well, he drives at night.
Right, exactly. That's high status.
Yeah, right?
Yep.
Yeah, that's awesome.
Hiten, I want to ask you again, especially since you're seeing this in your psych practice and you are asking these questions. Are there any sort of common themes or any things that have been coming up for you that you've been seeing clinically that are issues that men seem to be struggling with?
Oh yes, very good. So this is what most commonly happens. So we go through all this. Oh yeah, everything is good, everything is fine. We will talk about my depression. We will talk about that. We'll do sexual history. Yeah, no problem. And we call this the doorknob bombs.
Right.
Yeah, you know about this. Okay. As they're leaving, can I get a script for a Viagra? And it's like, well, have a seat. We just talked about this. And then, so, it's like, no, just give me the script. We don't want to talk about it. It's like, no, it doesn't work like that. Why don't we make another appointment for 45 minutes next time you are here? So you are not going to give me a script? It's like, well, I can give you a script, but it's not that simple to just give you a script.
Let's talk about how to use it.
Yeah. So we want to talk about, so is this a situational erectile dysfunction? And that was also another thing that sometimes I see. And, I only get erection if I watch porn. Okay. And I was like, so it's a situational thing then. So you do get erection, but you have to watch porn to get it. So then how do you maneuver it with your wife? Well, I'll sneak into the bathroom, and it's like, no. Why don't we just talk to your partner, and let's make it a part of the foreplay. And so that's often one of the things that there is a shame. If I need a Viagra, it's going to fix everything, So we don't have to really talk about anything. You just give me the script. I'll take the pill. I'll go into bathroom and I'll watch a little bit, and then I'll come out. It's like, no.
Bathroom with an erection.
Yeah, ta-da! I got this.
Right, exactly.
Yeah.
Right.
So there is a lot of that misinformation. Often, what they think the problem is, and how to talk about it. And I think we really it's so awesome that three of manly men, we are sitting around and talking about erection with each other. We are not afraid, and that's what we need to then normalize, and to say to people, hey, listen, this is okay. Like your eyes, nobody's afraid of wearing glasses. It's like, well, you need a little help reading? Is that what you need? Oh, okay. But then there is a sexual problem. Oh, no, I am not man enough.
Mm-hmm.
And it's like, so there is that machismo, or how do you call it, that real, what does it mean to be a man?
Mm-hmm.
And we don't talk about that, and we have this stigma that somehow it's like, oh, we don't talk about our feelings, and we definitely don't talk about sex. I mean, it's just something that we often brag about, and we make up that story, in the locker room. So I often find that even in the 50s and 60s, but the younger generation, I'm so proud that they're doing so much better. And I think the society is still changing, not as fast as we would like, but we are still not there yet, I don't think.
Yeah.
So there's a lot of work for us to do right here.
I've just really always been curious. I'm sure you told me this before and I've forgotten, but tell me again how you ended up in Lawrence, Kansas, of all places.
Oh, very good. I'm glad you asked. So when I did the residency, it was at the UMKC. So it was on the university. And then when I was finishing, I was fairly late in my life. I was like almost hitting 50s and graduating, and I wasn't sure like where I was gonna go get a job. My daughter was starting high school, and so I had two job offers. One was in Salina, Kansas. Yeah, I know nobody knows where that is either. Even in people next door to Salina, it's like, where's Salina?
Yeah.
It's like next door. It's like, no, I never heard of it. And then the other one was in Lawrence, Kansas. So unfortunately, everything you have, and I'm going to get letters from this, from your viewers in Kansas. Dear Dr. Soni, we don't feel about that, about Kansas. But unfortunately, everything you have heard about Kansas is true.
Yeah, I did a little time there.
Yeah, so you know what I'm talking about. Yeah. So if I had to live anywhere, Lawrence would be it, because it's university town. We have like people from all over the world coming in here, and there is a little blue island,
Right.
and
Yeah. Right.
And so if you had to be anywhere in Kansas, then you'd want to be in Lawrence.
So I want to, because you kind of indicate, right, when you're talking about being proud of a lot of the young people and the way they're handling a lot of these sexual issues, especially compared to older people. Do you find that especially younger men are not only more willing, but are they more able to speak intelligently about their bodies and sexuality?
Oh, yes. I find that the younger men have the vocabulary, and they have the vocabulary. There is a lot less stigma. A little bit there is a little bit of hint, just a hint of homophobia sometimes. You'll see, at least in the Midwest, where, they have to like, and how about them chiefs, And it's like, yes, that your masculinity is safe. Yeah,
Right.
we can. But there is a little bit of that. Like if I talk to another guy about it, what does that mean? And it's like, well, your cardiologist. Does it matter if it's a guy? Do you so then you can talk to your shrink about this, and then when you say and you ask him about the erections and ejaculations and things like that, and especially if they're taking any antidepressant, we have to go there. There's no way I'm going to give you an antidepressant and not touch that.
Right.
So we will definitely touch
them. Talk about it.
Good. Absolutely, we will talk about that. Like, no touching. Just talking about it. Yeah, so we definitely would go there and discuss it. It's like, hey, listen, I'm gonna give you these pills, but I want you to keep an eye on some of these things because it's fairly common, and if it happens to you, it's 100%. And that is a difficult concept because everybody's got Google now. So, and the guy's like, oh, it seems 17% of the people who take these pills may experience some sexual side effects. And then it was like, well, yeah, 17%, I get that. But if it happens to you, then it's 100%. And at that point, we cannot say, well, don't worry about it. It only happens to 17%. Like, no, it happened to you. So it's 100%. So that's why it's important to me that we talk about this before I give you the pills. And when you take the pills, you are well informed that not everybody will have this, but should you have it, that's the most important thing is that if you have it. And then we would even ask, like, hey, next time, can you bring your girlfriend? Can you bring your boyfriend? Or can you bring them both? And then we can talk about that. And then we can go there and discuss it and see. Because sometimes the men may not notice, but their wives or the girlfriend or somebody will say that, it doesn't feel the same. The drive has kind of gone down a little. And then he goes, really? And they'll be sitting next to them. It's like, yeah, honey. And it's like, well, you didn't say anything. Well, I'm saying it now, and so we get that. So we give that opportunity to discuss that and to say that, hey, this is an important part of the overall treatment. And I don't know who came up with this, but if a side effect of an antidepressant is lost in sexual drive, that would make a depression worse.
I've been saying that for years. You
We
think they
both
were
have.
depressed before?
Right, we both have. One guy's walking into your office going, can I please go back to being depressed?
Right.
Because at least I was getting some,
I got hard.
Yeah. So that's why we say that this is linked together. There is no way that we can ever talk about your depression in absence of a sexuality. Because it's like,
I think sometimes therapists get overexcited. They go, oh, you're on an SSRI. That must be it. We have to remember that depression can cause erection problems as well.
Right. So if the answer was that simple, they wouldn't need us. You would just go to your primary care and get some pills, and and Dr. Lee would say that, and even Dr. Renshaw was saying that in the 90s when the pills were coming, and it's like, wow, is this going to be an end to this? It's like, oh no, because the answer has never. When has the answer ever been in a pill, no matter what the diseases are? Exactly. So because it's something as complicated as sexuality, yes, there is a biological component, but it is just the one component. It's a multifaceted, complicated system. And so how is it that you can have a morning erection sometimes, but you don't have erection with and this is what I had learned in your class, and I'm so happy that you taught me, because we were always told that the morning erections was a full bladder. And then you were like, hey, wait a minute, that isn't true. And it's like, and you asked the class questions. I remember I was in the class, and you were like, oh, he's right. And it's like, well, that's why he's teaching the class, and we are not. Yeah. So that was kind of interesting. So we say, hey, so you're getting erection other times, but then when you have to have sex, sometimes you're not. So what is happening? And that is a situational thing. The pill isn't going to fix it. Right. And so this is something happening in the relationship. Oh, yeah. And so I get this often, and we'll get that. You go, well, I was laid off, and then I was at home, and then I was doing laundry. And, he wants to help out, and I get that. But then all of a sudden, something happened, because she comes home, and all of the roles are reversed, and the gender scripts, and it's like starts doing a number in the dialogue in your head. And I was like, wow, I was cooking today, and then I was doing laundry, and then I had to do this, and then And then when she came home, I was exhausted. And then I didn't, and it's like, well, we need to talk about that, and to say, well, it's not just an erection problem. Now the gender scripting is kind of turned its way on its head. And then, so now you don't feel like a man enough or something.
Never too tired.
Exactly.
That same guy 20 years ago would work a double shift and run home on foot for the chance to have sex.
Yeah.
Now
And now, and so now he's like, oh, so it's like, is it that you are tired? And I get that, we get that because it's I get that it's a lot of work. And the women would tell us that those who work in home, and they would say that it just never ends. The work never ends at home. So the men often would come home. Like, what did you do today? I was working busy. I was making money. And it's like, well, her work never ends. It's like a 3 full-time job. Right. So now when the shoes are reversed, and then now it feels like, oh, so you're doing some of this, and then all of a sudden I'm tired. It's like, if you're tired, I get that. But is there anything else happening? Right. And then it will come out that, well, because when she comes from work and then she talks about her work day. And I don't want to talk about her work day because I've been cooped up in here with the kids and I'm doing this. And so do you see any of that in your practices? Yeah.
Yes.
Yeah. There is that gender scripting is starting to change a little.
But I was going to say also older folks more so than younger. Yeah, and I'm happy to see, again, giving some credit to millennials and Gen Zers. Polyamory is a lot more normalized and kink is normalized. Though I met an interesting couple recently that were 180 degrees apart. She was really, really kinky, but just could not bear the thought of another person. And he wanted to open the marriage, but was so vanilla that he couldn't do any of the kinky things she wanted. People tend to think if you're kinky, you're poly. If you're poly, you're kinky. Very different world sometimes.
Right. So
we'll have to have you back to talk about that world because I know that's
absolutely
an area of interest for you as well.
Yeah, we'll definitely do that.
It's just been such a pleasure catching up and seeing you after it's been too many years.
It's way too long.
So
let's do it again soon.
Absolutely,
yes.
My word. We will be talking soon, and we got some other things to talk about too off air. So
all right,
we'll be in touch very soon.
Well, thank you, gentlemen, for having me. I had so much fun.
Soni from Lawrence, Kansas, psychiatrist, sex therapist extraordinaire.
Indeed.
Keep up the good work.
Yes, indeed. Thanks so much. Yes, absolutely.
Bye-bye.
So, always enjoy talking with Dr. Soni.
Thank you, Hiten. Always a pleasure.
Yes, indeed. Yes, indeed. And always good information, too. So, that wraps up another episode of Sex Talk with the Siegel Brothers. We want to encourage you guys out there especially, certainly everybody, but really you guys in particular, to really make a point of learning about this stuff. Understand your body. Talk to somebody who really does have good information. Get a doctor that you can trust, that you can talk to, that is willing to listen to you.
And there is good information on the internet.
Yes, there really is.
It's not all porn and smut.
Exactly.
There's excellent sexual health information all over the web.
Yes, indeed. So thank you, my brother.
Thank you, indeed.
And thank you all for watching us for another edition of Sex Talk with the Siegel Brothers.
We'll be back next Friday and every Friday at 7 p.m. on the East Coast.
Stay safe.
Thanks for watching Sex Talk with the Siegel Brothers. Join us each week on Friday at 7 p.m. Eastern. You can also follow us on Facebook and subscribe to our YouTube channel to stay on top of the latest developments in the ever-changing world of sex and sexuality.